good. All right, so we're just gonna be talking about setting up your accessory tray. Things that you're gonna need to have before you come over to the unit are your 2x2s, your anesthetic syringe, a carpule, and the needle. For this procedure first semester, we'll be working on a maxillary anterior tooth, so you can always select a short needle. And then you'll have cotton rolls and a cotton tip applicator for our topical. Keeping in mind that theoretically you can do all of this with clean, dry hands, we have seen that some offices opt to wear exam gloves, which is fine also. So you're going to need to grab your composite bin. I'm going to take my discs out first. So I'm going to use the blue family of discs, and I'm going to grab from my coarse, my medium, my fine, and super fine. I want to make sure that I'm putting the disc color side up so they are ready for me to use during the procedure so that the operator can see the colors which are indicating the grit. I'll put this off to the side for now so I can get my composite bin. Again, as part of the procedure, you'll be taking a shade, and in the office at that point, once you got the shade, you would select your composite. For ease of the procedure and getting you through that now, you can pre-select your composite. So you'll have a bin of compules in that drawer, or you can just select one here. So I'm going to select that, and I will need my composite gun. You can use either gun. We talked about the fact in class that this one just loads on the underside, and this gun loads on the top. And you want to load that right in ahead of time. Just pushing that in. I'm going to get my finishing strip. I need a micro brush, which some units have set up here, or there's a dispenser in that same drawer, and this is going to be to apply the bond. I will use paper for recapping. I will need my well for my bond, which I will dispense now ahead of time. You need to make sure just 1 or 2 drops of bond in that number 2 well, so right in that middle well. Close that because it is a light sensitive material, and then the bond will go back in. Since we're over here, I will dispense my topical onto a 2x2. We do also have the 6-inch cotton tip applicators if you needed that for a posterior area. My burrs I'm going to select while we are right here as well. So I need the straight fissure to start. I need a long thin diamond friction grip. I need my mandrel, and I'm going to put my first disc right on that. Remember, when you load the disc onto the mandrel, the color should be facing us so that the abrasive is facing the tooth. And I need my latch type round burr for the slow speed for decay removal. So I have my burrs out and ready to go. Before we get started, I will put my first burrs on. So before the procedure gets started, you should put your straight fissure and your high speed and the round burr and the slow speed. I am now going to get my etchant. The storage cap should be kept here. I will get a blue cap, and then after I will grab a syringe cover for that. I need my wizard wedge, and we know here that the interproximal area are very large on these mannequins, so you want to select a larger wedge here. And I have that. So just take a look in your bin and you're like, do you have everything? Articulating paper, remember you want to use about half of that so I can take out the whole thing. I can tear that in half, and I will put that on once I put my gloves on because I do not want to touch that without my gloves. And my shade guide. So the Vita shade guide, we will put that out here as well. So take a look again and double check and make sure you have everything that you need to get started.